I'm Dr. Amber Lautzenheiser. I'm an internal medicine physician and I work at Adams Memorial Hospital in the Berne and Geneva offices. The things that sustain me and keep me passionate about healthcare are seeing patients make their own changes and improving from that. So seeing patients who've had uncontrolled diabetes, have had obesity, them finally taking control of their own health and making changes and them improving their numbers or improving their weight and just being so extremely happy with the results really sustains me, and it keeps me wanting to do what I do. So the advantages of practicing medicine in a smaller community, specifically in Berne where I live and also practice medicine, is I get to see these patients out in the community. Most of my patients have grandkids who are my kids' age, so I'm out there at the ball fields with them, I'm at the dance recitals with them. I get to see and interact with them in the community, which is a very unique opportunity that most physicians don't get. It really helps to make the people more human. So instead of seeing them as a disease or as a case or as a patient, I see them as so-and-so's grandpa or my neighbor's mom. So when considering Adams to other hospitals in the area, a lot of things that larger hospitals provide, we also can provide. It's very likely that coming to Adams, you will have an expedited workup. Something that may take months for you to do at a larger hospital will likely take days to weeks to get done at Adams. We are unique in that we live in a small town, and so a lot of us know each other. You likely know someone who went to Adams or you know someone who works at Adams. When you come to Adams, you're like family and we're going to treat you like that. You're going to form relationships with the nurses, with our staff, and you'll be treated like a family, which at the larger hospitals you just may not have. So I chose internal medicine because when you are in medical school, you get to rotate through everything to really see what you want. And I found when I was rotating through certain fields, specialty fields, I really cared more about the whole patient than that just one specific disease. So I was caring more about what about their diabetes, what about their blood pressure, what about their thyroid. And so that's really what drew me to internal medicine. You get to treat the whole patient and I get to see them back. And that's what an internal medicine doctor does. We're there for the journey. We're just not a pit stop, and I get to treat everything and not leave stuff out. So in my day-to-day work as a physician, things that bring me joy are just seeing patients doing great. So probably my favorite patients to see are the ones who maybe they have a little bit of blood pressure issue, maybe they have a little bit of pre-diabetes. I talk to them about it, and then all of a sudden they come back and they've lost 40 pounds on their own. And they say this is the best that they've ever felt. That is an amazing visit for me. It's really cool to be working in the southern half of the county because previously these patients had to travel up to Adams Memorial in Decatur to get any services. Now they're traveling in their backyard. Some of my patients take a golf cart to come see me. I think it's a very awesome opportunity that Adams Memorial is really focusing on the southern part of the county, and so we're able to offer them more services than they've ever been offered before, and I'm really excited for the future and what's to come with that.